the pharmacological terminologies and other concepts relevant to the study of pharmacology. Okay, and most especially, we were able to describe the main focus, the main heart of pharmacology, and that is drugs. Diba? So medyo na ako'y modification gamay sa akong presentation. Alang ko'y gi-add, wala ko'y gi-erase, medyo na lang ko'y gi-add. Okay? So we were able to discuss last meeting the heart of pharmacology, which is all about drugs. Okay? Wherein we define it, diba, as any agents or any chemical substances that is able to interact in the body to produce an effect. Or particularly, this statement presented sa PowerPoint, okay, kaning statement about drugs, this is by its chemical structure, no, or by chemistry na definition ng drugs. Most of the drugs are in its low molecular weight, okay, state. Okay, so drugs are also defined as low molecular weight chemical substances that interact with macromolecular targets in the body to produce an effect. So, i-highlight niyo ang targets because these macromolecular targets that targets can be in the form of protein bakaha, okay, in the body, or pwede din yung drugs can interact in the body via targeting nucleic acids. Okay? But ang pinaka most common gyud na target sa excuse me most of the drugs is protein. Okay? Ayan. All right? So when we try to analyze this definition of drugs, we can infer then that there is really a close relationship between drug and body. Okay? Drug and body naa sila'y close, very close relationship. Okay? So may close relationship sila between drug and body. Kasi nga, for a drug to produce an effect, again, for a drug to produce an effect, it must be powerful enough, it must be selective enough to target proteins and nucleic acids inside the body. Okay, I repeat, a drug must be powerful and must be selective enough, okay, to target a specific protein or to target a specific nucleic acid inside our body to produce an effect. Okay? Now, the next question here is, paano ba nakakarating yung drug sa target site niya in the body? Paano itong drug na to, okay, nakakarating sa target site niya in the body? So, yung question is how? Okay? How? Sensya na sa agi. Okay? Okay, how will the drug kaya reach the target site in the body? Of course, the body, itong body na to, should interact well with the drug. Okay? That is how a drug must reach the target site in the body. Dapat ang drug pod mo participate. Diba? Mo interact po siya, mo do po siya sa yung responsibility to accept that drug. That is why, diba, na-mention ko last meeting, by relating drug to the body or body to the drug, we have two main concepts of pharmacology that really helps explain this relationship. Okay, so we have una, kung for a drug, pag drug to the body, yung concept, okay, or yung powerful selective interaction ng drug sa ating katawan, we must consider the field of, ano yun? So, i-type daw ba ang answer? Is it dynamics or kinetics? If it is drug to body, we must consider the field, yes, very good. We must consider the field of pharmacodynamics. Okay, if it is drug to the body. Okay, then this particular field in pharmacology, this will be discussed on lesson 2 under module 1 pa rin. Okay, lesson 2 na natin yan, pharmacodynamics. Okay, so tandaan, okay, tandaan ha, the way the drug interacts to the body, okay, producing an effect or yung mechanism ng drug as it interacts to the body, that is dynamics. Tapos on the other hand naman, when the body interacts naman, okay, with the drug, excuse me, or the way this the body accepts the drug, okay, ang tawag natin doon is pharmacokinetics. Okay? So, I hope dili na ninyo siya malimtan. Bahalag basic ka siya, memorize na ninyo siya. Kay biskan dito ang basic, malimtan na siya miski ka ng pag-abot na ninyo sa higher years sa kuan mo, fourth year na mo. Okay? Ang basic gid ang mga limtan, mas ma-memorize na noon ang mga complex, no? Kayo gid ninyo kalimti ang basic. Okay? So, ito yung dalawa sa pinaka-important concepts in relation to pharmacology. Okay, so we will shortly begin with our discussion on these principles of pharmacodynamics and principles of pharmacokinetics after we finish discussion of classification of drugs. Kasi dun tayo nag-stop last meeting, di ba, sa classification of drugs. Okay? Ayan. So we have 4. Again ha, general classification of drugs. Na-introduce ko to last meeting, starting with functional modifiers. Excuse me. So again ha, functional modifiers, these are agents that are able to modify. Okay, yan na yung mismong term niya, yan na yung hint nyo to define the property of drugs under this classification. They modify, they alter the function, okay? The normal function of the cell in the body. Okay, so I have introduced already colchicine. Paano siya naging functional modifier? Again ha, si colchicine, this is the first line agent in the management of gidaw be type sa ganito nga sakit. Okay, very good. First line agent in the management of gout. Okay, with its mechanism of action, targeting a structural, very good, structural protein. Ano yung structural protein na tina-target ni colchicine? Ano yung structural protein na tina-target ni colchicine? Very good, tubulin. Okay, tubulin. Very important, very good. Very important si tubulin for cell movement. Okay, very good. So, upon targeting, take note ha, si colchicine, tina-target niya yung tubulin. Okay? Tubulin. Okay? Now, upon targeting this tubulin, which is a structural protein, okay, via depolymerization ng tubulin, napipigilan. Ano yung napipigilan? Napipigilan yung movement, okay, M na lang ha, movement of inflammatory cells. Okay. So, yun yung MOA ni colchicine. Wala siyang activity towards the uric acid in the blood. Okay. Meron lang siyang activity towards the pagpigil sa movement of inflammatory cells. Okay. Now, we also have other example ng drug considered as functional modifier. Example, we have omeprazole. Okay? Omeprazole can also alter the functioning of cell in the body. So, i-introduce ko si omeprazole ha para ma-appreciate nyo yung mechanism of action niya. Okay? Si omeprazole This drug is classified, I think you're familiar with omeprazole, labi na ka ng mga gipang ulcer. Any idea? Ano yung omeprazole? This is for what?
Kuan ma'am, proton pump inhibitor.
Very good. Very good, Miss Remeliete. Omeprazole is a proton, ako na lang i-abbreviate. Okay? This is a proton pump inhibitor or PPI. Okay? This is a PPI. Again, ang meaning sa PPI, proton pump inhibitor. Okay? This is known for the management of hyperacidity. Okay? For the management of hyperacidity. Okay? Ayan. Now, yung question ngayon, ano ba yung proton pump? Okay? Proton pump muna ha. Ano ba yung proton pump? Okay? Bakit kapag ini-inhibit yung proton pump, pwede siya gamitin against hyperacidity. Okay? So, wala munang gamot dito ha. Wala munang gamot. Intindihin muna natin ano yung proton pump. Bakit kaya pag gina-inhibit siya, pwede siya gamitin for hyperacidity? Okay? Yung omeprazole. Okay? So, alamin muna natin ano yung proton pump. Proton pump is also known as the proton. Di ba sa chemistry, ano yung proton? Di ba H plus? Okay. H plus or hydrogen ion, hydrogen potassium pump. The same lang na sila. Proton pump is also known as hydrogen potassium pump. Okay? This is an example of carrier molecule. Example ni siya sa carrier molecule in the body. Okay? When you say carrier molecule, these are cell membrane proteins. Isang proteins. Okay? Ang carrier molecule. Isa yung klase ng protein. Ang daming carrier molecule sa body. So, example ng specific carrier molecule sa body is proton pump. Ano yung in general carrier molecule? These are cell membrane proteins with specific binding site na kung saan, kung nakapag-bind na yung specific drug or endogenous substance in that proton pump, nag-undergo yung carrier molecule ng conformational changes. Okay? Now, ang specific function ng proton pump as a carrier molecule is that it is a carrier molecule that mediates the release, okay, the release of the following, okay, the following endogenous compound. We have acetylcholine. Kamu na mag-spell out ha, acetylcholine. You can search sa internet on sa spelling acetylcholine. Gastrin. Ito yung nire-release. Okay, once na-activate yung proton pump. Gastrin, tsaka histamine. Okay? So, yan. Again, itong carrier molecule na to, wala pang gamot ha, wala pang omeprazole. Proton pump muna. This particular carrier molecule, it mediates the release of acetylcholine, gastrin, histamine. Mga natural substances or chemical substances in our body. Okay? Now, ano ba yung common sa tatlong to? Ano yung common action ng tatlo kapag na-secrete ang mga ito, kapag na-release ang mga ito? Tandaan, okay, listen, tandaan, these three substances influences HCl secretion. Okay, again, etong tatlo na to, once na-release yan, available for action, nag-i-influence sila sa HCl secretion. So most probably, kapag ang daming na-secrete na acetylcholine, gastrin, histamine, posibleng tumaas yung HCl secretion. So end result, ano yung end result? Kapag mataas yung HCl secretion, pwedeng magkaroon ng hyperacidity, di ba? Okay? Ito yung end result. Okay, kahit yan na lang, increase HCl secretion. Okay? Ayan. So, i-arrow lang na ako. Okay? Now, ipasok natin ngayon yung gamot na omeprazole. Ano nga ulit yung action ng mechanism of action ng omeprazole? It is simply a proton pump inhibitor. By the term itself, yung I dyan, inhibitor, kaya niyang i-inhibit, ibang kulay na lang, kaya niyang i-inhibit yung proton pump or parehas lang yan, or the hydrogen potassium pump. Again, it inhibits or blocks the function of hydrogen and potassium pump. Kaya, kapag napigilan yung activation ng proton pump, what will happen to the release of acetylcholine, gastrin, histamine? Pigil ba ang release or padayon gihapon i-type daw? Pigil or not? Mag-secrete gihapon siya, ma'am. So walay nitubag or lag lang ako ang kuan. Again, inhibited yung proton pump. Inhibited yung proton pump. Very good. Wala na nga yung proton pump, that will release the following. Okay, very good. Okay, so ang implikasyon nito sa HCl secretion, ano yung implication nito sa HCl secretion with omeprazole? Taas ba or baba ang HCl secretion? Taas or baba? Type your answer, go. Very good. Low. Bababa. Okay, bababa ang HCl secretion. Yung kulay violet, meron ng gamot ha na omeprazole. Okay? Bababa. Very good. Okay, very good. Nice. Okay. So, that is why ang omeprazole, pwede siyang gamitin to manage hyperacidity. Kasi napapababa niya si acetylcholine, gastrin, histamine via inhibiting the proton pump. Okay, talagang bababa yung HCl secretion. Okay? In fact, i-type nyo na lang ha, i-write down na lang ninyo. In fact, yung proton pump inhibitors, they are said to be the first line in the management of acid peptic diseases. Okay? So delete na ko. I hope inyong screenshot pero recorded naman. Okay, again, take note natin. First line. Okay? Again ha, ang PPIs, not just omeprazole, when you say PPIs, okay, nga classified nga drug, they are considered first line. Okay? In the management of acid peptic diseases. Unsa example sa acid peptic diseases? Ulcers. Okay? Diseases. DS na lang. Okay? So example, ulcer, GERD. Okay? Yan. Those are example of acid peptic diseases. GERD is gastroesophageal reflux. Yung reflux pa. Reflux disease. Okay? Yan. Okay, so I hope naintindihan yung action ng omeprazole. But although, although there are other agents for hyperacidity, there are a lot. There are a lot of agents for hyperacidity. Meron tayong antacid, di ba? H2 blocker. Okay? Pero mas powerful, okay? Most efficacious talaga yung proton pump inhibitor. Based on its mechanism of action. Sige, example na ato i-compare. Okay, mag-comparison ta para ato yung ma-check kung mas effective ba gyud siya. Okay, comparison. Okay, let's try to compare OMEP, kamo na lang magsumpay, omeprazole versus that of an H2 blocker nga ranitidine. Okay? Or kung dili mo familiar kay ranitidine, kahit kay famotidine, cimetidine man lang, or nizatidine, itong mga tidine, these are H2 blocker, histamine 2 blocker. Sige, sulat na lang na ako ha. This is an example of H2 blocker. Famotidine, kung mahilig mo magbasa sa inyong ginainom nga tambal, kuha ni siya, kung nakatake na mo og Kremel S Advance, Kremel S Advance, hindi yung kulay pink ha. Kremel S plain man to siya. Katong Advance kulay blue. Okay? Ang Kremel S Advance, naana siya present sa may component ana nga H2 blocker, and that is famotidine. Okay, si famotidine. Okay, H2 blocker. Now let's try to compare. Bakit mas effective si omeprazole kaysa kay ranitidine? Omeprazole again is a PPI. Basta PPI, kaya niyang i-lower ang the following: acetylcholine, gastrin, and histamine. Okay? Ano nga ulit si ranitidine? Isa lang siyang histamine 2 blocker. Ang kaya lang niyang i-block, histamine 2 receptor. Okay? Therefore, ang iyaha lang ma-lower, okay, ma-lower, kung minus gani nga akong gi-circle, block na siya, muna ako ang signage sa gi-block or gi-inhibit, minus. Okay? So, kaya niya lang i-lower is histamine. Okay? Histamine. Ayan. Therefore, kahit na-inhibit niya si histamine, there are still other endogenous substances that may influence HCl secretion. Di ba? Andyan pa si acetylcholine. Andyan pa si gastrin. Again, andyan pa si acetylcholine at saka si gastrin. So, posible pa rin may possibility na tumaas yung HCl kapag na-trigger yung release ng mga endogenous or natural substances na ito. That is why most efficacious ang PPIs when it comes to hyperacidity, managing hyperacidity. Okay, so madali lang ma-identify yung mga PPIs ending in prazoles. Yan yung tandaan nyo. Okay? Basta ending in prazoles nga mga drug. Okay, naman tayo mga timailhan sa mga suffixes sa drugs, but hindi lahat. Na-agree uban drugs nga kailangan gid memorizeon. Pero na po'y drugs nga pare-pareha ang ending. Okay, pareha og suffix ba? Okay? So for example, si PPI ending in prazoles, example omeprazole, esomeprazole, lansoprazole, pantoprazole. You can search, okay? Basta kay prazoles, PPIs yan, except na ay isa ka ending in prazole pero hindi siya PPI. So paki-take note, color red na lang, except, ayan, except aripiprazole. Piprazole. Unsa din ang aripiprazole? Isa yang anti-psychotic drug. Okay? Isa yang anti-psychotic drug, aripiprazole. So, prazole pa rin yung ending pero hindi siya omeprazole. Okay? Bakit meron siyang prazole pa rin? It has something to do with its structure. Okay? Siguro may structure yung mga PPIs na meron din si aripiprazole. Okay? Kay, I think naman yata mo yung PChem2. Sa PChem2 na ninyo ma-realize na kaning mga gipangyaw-yaw na ako nga action sa drug, dili lang ni siya gitagna-tagna ang ilang action. Naay relationship ang structure ug action sa drug. Magbase ang iyang action depende kung unsay present nga structure sa usa ka drug. Okay? So, again omeprazole is an example of functional modifier. Kasi na-alter niya yung function ng proton pump. Diba? Yan ang na-alter ang function ng proton pump. Proton pump is a cell, carrier molecule. Siya, diba? Ayan. Okay? So, nagdugang kong isa Kasi later on, ma-mention natin si NSAIDs. So, karon pa lang, since ako siyang ma-mention again sa lesson 2 under Pharmacodynamics Principle, ako na lang siyang i-introduce karon, okay? Para later on, kung ma-mention siya, ma-mention ako again ma-mention sa lesson 2, familiar na kayo, so dili na kay nako siya super explain. Alright? So NSAID is also an example of functional modifier. Kaya din niyang mag-alter ng biochemical activities ng cell in the body. Okay, so one last example under functional modifier. Okay, so NSAID, I think you're all familiar naman sa NSAID. What does it mean? Non-steroidal anti-inflammatory drugs. Okay? Now, mechanism, diretso taha siyang MOA. Mechanism of action ng mga NSAIDs is that they inhibit, okay? They inhibit the enzyme, okay? The enzyme COX, okay? COX, i-abbreviate na ako. COX, this is cyclooxygenase enzyme, okay? COX is cyclooxygenase. Isulat na lang na ako ha. Cyclooxygenase, ending in ase. So obviously, this is an enzyme. Okay? Again, yun lang, ang MOA ni NSAID ha. It inhibits COX. Ano lang, it inhibits COX, NSAID. Now, ano ba yung enzyme na COX? Okay? So, kanya to ang to ang i-answeran karon. Ano ba yung enzyme na COX? Ano ba yung function niya? Bakit kapag gina-inhibit yung COX, merong anti-inflam effect? Okay? So ato sang pangutan-on sa tung self kinsa din na si COX, unsa yung relationship sa inflammation? Nganong kung i-inhibit siya, na ay anti-inflam effect. Okay? Ang usa ka drug. Okay? Okay. So let's focus sa COX ha. COX muna, COX enzyme. Ano yung COX enzyme? Okay, saan ba involved yung enzyme na to? Okay, COX ha? COX or the cyclooxygenase enzyme. Okay, basically, this enzyme is involved in the production of prostaglandin. Okay, this is very much involved in the production of prostaglandin. So I know kabalo na mo ana nga mga term na introduce man ang prostaglandin sa sa biochemistry. Prostaglandin is a lipid. Okay? And I believe familiar na mo sa prostaglandin in your biochemistry, di ba? This is said to be a group of physiologically active lipids. Syn is synthesis. Dili na siya syntax error, synthesis. Production or synthesis, somehow correlated rin sila. Again ha, si COX, involved siya sa prostaglandin synthesis, prostaglandin production. Okay? Now, i-introduce ko ngayon, ano ngayon yung relationship kapag nakapag-produce ng prostaglandin? Ano yung relationship niya sa inflammation? Bakit kapag nag-inhibit si COX, na-inhibit si prostaglandin, merong anti-inflammation? Okay? So, I will introduce to you saan nanggaling talaga yung prostaglandin, bakit pumasok si COX. Okay, let's have the COX pathway. Sumpayan ako siya ha, COX pathway. Okay? Yung major source, yung pinaka-major source saan galing si prostaglandin. Okay? Yung production ng prostaglandin. Bakit pumasok si COX? Okay? Sa play. Okay? Now, major source sa COX pathway, major source ng prostaglandin, okay? Major source ng prostaglandin is what we call the phospholipids. Okay? The phospholipids. Okay? And again, familiar gihapon mo sa phospholipids. I hope wala ninyo gilimtan yung biochem phospholipid. These are hydrolyzable lipids. Okay? Hydrolyzable lipids po yan. Ibig sabihin ng hydrolyzable lipids, they are capable to undergo hydrolysis reaction. Okay? So, ang phospholipids, okay, iyahang roller gid ana ma-hydrolyze gid siya as a hydrolyzable lipid, ma-hydrolyze siya enzymatically via the presence of the enzyme phospholipase A2. Paminaw lang gid mo ha. Sige lang inyo maning re-access ang recorded lecture. Phospholipids again as hydrolyzable lipids. Okay, they are being hydrolyzed enzymatically by the presence of the enzyme phospholipase A2. Okay? Now, kapag na-hydrolyze syempre ang isang lipid, 'di ba yung product kapag na-hydrolyze ang lipid, makapag-produce ng fatty acid. And yung fatty acid na yun is what we call the arachidonic acid. Okay? Arachidonic acid. Akong gipangyaw-yaw kay na-mention ni siya sa inyong biochem because these are related to the macromolecule na lipid. Okay? Now, arachidonic acid, this is a fatty acid product of hydrolysis ng phospholipids. Gihydrolyze ni phospholipase A2. Now, ngayon, kapag na-produce na gani si arachidonic acid, ang iyahag yung fate, ang iyang destiny, duha na ka pathway iyang agian. Okay, again, once ma-produce yung arachidonic acid, dalawa yung fate na iyahang agian. And one of that pathway is what we call the COX pathway. Yung isa, okay, yung isang pathway, ayan, is the LOX. Okay? LOX pathway. Lipo-oxygenase pathway. Okay? These enzymes are capable to metabolize arachidonic acid. Okay, kaya nilang i-metabolize si arachidonic acid into eicosanoids, different eicosanoids. Nganong eicosanoids ang tawag, ma'am, sa mga metabolic products ng arachidonic acid? If you recall arachidonic acid in your biochemistry, chemically known ni siya as eicosa tetraenoic acid. Okay, yan yung chemical name niya. Pwede ninyo i-search balik, i-scan over inyong notes sa biochem. Eicosa tetraenoic acid. Kaya yung byproduct niya, somehow, gikan sa iyang root name. Okay, chemical name. Eicosanoids, yung product sa baba, metabolic products in general ng metabolism ng arachidonic acid. Okay, now focus tayo sa COX pathway kasi dito related yung gamot na presented, which is NSAIDs. Okay? Now, ano ba yung eicosanoid na napoproduce, na-synthesize under COX pathway? Example doon is, nasa slide, si prostaglandin. Okay? Si prostaglandin. Now, ano ba yung effects kapag na-produce si prostaglandin? By the way ha, hindi lang prostaglandin yung napoproduce na eicosanoid under COX pathway, pero ako lang i-pinpoint si prostaglandin kasi dito related yung inflammation. Okay? Napod ay other nga eicosanoids nga ma-produce under COX pathway. We have prostacyclin, yung thromboxane, etc. Pero ako lang i-introduce si prostaglandin here, which is related sa NSAIDs. Okay? Now, ano yung effects, usual effects kapag na-produce yung prostaglandin? Una, take note nyo, una, we have prostaglandins that are very important for cytoprotection purposes. Unsay meaning sa cytoprotection? Take down na lang ninyo kay wala na space sa baba. Kung may nga kag cytoprotection, meaning very important for the thickening, okay? Pagpapakapal, okay, ng lining of stomach. Okay, thickening the lining of stomach against HCl, okay, secretion. Again, when you heard about cytoprotectant, cytoprotective effect, iyahang main function ana, sorry, is to thicken or thickening the lining of stomach against HCl or pagtaas ng HCl. So yan yung una. Okay, so we have certain prostaglandins nga mayroong cytoprotective effect. Pangalawa, meron ding mga prostaglandins, okay? May mga prostaglandins din that are produced or synthesized in the setting of pain and inflammation. Okay? So yan. So natin mga prostaglandin nga very good for normal cell activity which is cytoprotection. Very important biya yung cytoprotection. Okay? Ang lining kanang ga-maintain sa uh, lining sa atong stomach. Okay, para protected ang atuang stomach against increase of HCl level sa stomach. That is a housekeeping kumbaga nga activity or function. Okay, very important ba? Part siya sa normal gid nga dapat function sa cell activity. Now, ang number two, naapod tay prostaglandin nga gaka-synthesize in the setting of pain and inflammation. Pain and inflammation, this is actually mechanisms ng body natin, no, to counteract any pwedeng infection or any injury na mahitabo sa atong tissue, etc. That is very normal ang pain and inflammation. Okay? Pero kung masubraan ang pain and inflammation, delikado na siya, di ba? Okay? So ngayon, nabuo ko na yung COX pathway, ipasok na natin yung drugs na NSAIDs. Okay? Ipasok natin yung drugs, yung gamot na NSAIDs. Sabi kanina, NSAIDs na taha, isulod na to. Okay, si NSAID. Sabi kanina, yung MOA niya, mechanism of action, it inhibits the enzyme COX. Tama? Kaya niyang i-inhibit yung enzyme na COX. Yun lang, yung mechanism of action niya. Okay? Therefore, okay, inhibition of COX pathway by NSAIDs, that will also inhibit the production of prostaglandin. Inhibited man ang COX. Okay? So, dili magpadayon ang synthesis ng wing or pathway on the left. Tama? Itong pathway on the left, dili magpadayon kasi nga na-inhibit yung COX, bababa, or inhibited yung prostaglandin synthesis. And therefore, pag inhibited ang prostaglandin, especially in the setting of pain and inflammation, okay, in the setting of pain and inflammation, pigil yung pain, pigil ang inflammation. Okay, so kung pigil ang pain, pigil ang inflammation, anti-inflammatory. Okay, that is why kapag na-inhibit ni NSAID yung COX, meron talaga siyang anti-inflammatory activity. So that is the mechanism of action ng NSAIDs. Are you learning? Okay pa ba mo? Pwede mo mag-comment? Okay pa ba?
Okay pa, ma'am.
Okay.
Okay pa ma'am, we are
Okay pa,
learning.
ma'am.
Very good. That's nice. Sige. So, padayon ta. Okay, relax lang. Padayon lang ta. Okay? Now, karon ang problema, okay, beneficial nga si NSAID. Diba? Beneficial siya as anti-inflammatory in the setting of pain and inflammation. But you have to take note as well, na upon inhibition of prostaglandin synthesis, meron ding na-i-inhibit na normal cell activity. Okay? Hindi lang pain and inflammation yung na-i-inhibit. Okay? Kay general man nga prostaglandin, COX ang iyahang gi-block, inhibited lahat. Okay? Nabablock din yung normal cell activity which is cytoprotection. protection. So, na-inhibit din yung cytoprotection. Now, tandaan na ang prostaglandin cytoprotectant, very important to thicken the lining of stomach. Tama? Very important siya to thicken the lining of stomach, protecting it from the acidity brought about by increased HCl, okay, in the stomach. So, yan yung negative side about NSAIDs. Okay, negative side yun na siya sa NSAID. That is why, ano yung usual nga recommended or advice nga time to take NSAID. Okay, na ay remedy ani para ma-manage ni nga other action of NSAID. Do we have to take NSAID before meal or after meal? What do you think? Very good. Okay, General, very good. Okay, very good everyone. Cesar, Aceron, Quercus, Graphil. Okay, di na lang kayo mention tanan. Very good. Ang remedy nato ani to manage this other action of NSAID is that yung patient and consumers, kayo na mag-take note ha, wala na kayo sing space. They are advised to always take NSAIDs after meals. Okay? Again, NSAIDs must be taken after meals. Kasi, 'di ba? Kasi with meals, somehow protected yung lining ng stomach, knowing na kapag kumain tayo, napapababa yung HCl. So, tsaka ka na kumain. Tsaka ka na uminom. Tsaka ka na uminom. After mong kumain, tsaka ka na uminom or i-take yung NSAIDs. Okay? That is the remedy for that negative side ng NSAID. Okay? Kasi listen ha, dili gina ninyo siya i-neglect nga advice when it comes to taking NSAIDs. Kaya there are cases nga ang pasyente pwedeng magkaroon ng ulcer caused by a drug, caused by NSAID. So meron tayong tinatawag nga ulcer type nga NSAID induced. Ako isulat ha. NSAID induced ulcer. Okay, natay ginatawag nga ulcer type nga ang gakos sa ulcer isang gamot. Okay, so NSAID can cause or can induce. Okay, it can induce ulcer. Okay, so this is si NSAID very common na siya nga drug that can potentially cause or result to ulcer. Okay. So based on the pathway presented earlier, you can now rationalize, ma-rationalize na ninyo bakit posibleng magka-ulcer with NSAIDs kung mali yung pag-take. Labi na kung continuous, example, giresetahan ka, nagkanang bago ka ibot og ngipon, di ba, resetahan magitag NSAID, example, mefenamic acid for 4 to 5 days or 4 to 6 days or in a week, ana. Okay, or usually 4 to 5 naman na siya or 3 to 5. Okay? So make sure you take the NSAIDs, okay, after meals good. Okay? Labi na kung 3 times a day or 2 times a day. Okay? Kay delikado gid kaayo. Pwede gid mo magka-ulcer. Pwede ma-induce ang ulcer if mali yung pagka-take ng NSAID. So NSAID is an example of functional modifier. Diba? Gimodify niya ang biochemical activity ng isang cell in the body. And that is the COX, diba? The enzyme COX. Okay? So, there are other drugs na pwede ding mag-target sa pathway na to, no? Yung buong pathway na to, yung arachidonic acid metabolism pathway. Si LOX, okay? Introduce ko na lang, madali lang to. Si LOX, kapag mo ma-metabolize si arachidonic acid via LOX pathway, that mostly causes bronchoconstriction. Okay? Constriction. Now, naatay drug that could inhibit LOX pod. Okay? So, naatay drug that could inhibit. Minus is inhibit. We have Zileuton. Okay? So, isang drug that could target LOX. Okay? Iyang ginablock ang LOX. Okay? Is Zileuton. Okay? Therefore, kung gi-block niya ang LOX, ano yung opposite ng bronchoconstriction? Okay? Gi-block man niya ang LOX, hindi na bronchoconstriction. Broncho, Very good. Very good, bronchodilation. And usually, asa ginagamit nga condition ang mga bronchodilators na ay asthma. So, anti-asthma si Zileuton. Anti-asthma si Zileuton kasi meron siyang, ayan, bronchodilating activity. Meron ding drugs that could inhibit PLA2. Okay, yung steroids, ay, kaila mo og mga steroids. Di ba? Corticosteroids. Ayan. Block. So, minus ha. That could block, okay, PLA2 steroids. Okay? Now, question, do you think si steroid, do you agree with me nga si steroids, okay, upon blocking PLA2, meron siyang anti-asthma, meron din siyang anti-inflam activity. Do you agree? Yes or no? Si steroid, upon blocking PLA2 enzyme, okay, is it possible nga meron din siyang potential anti-asthma and anti-inflammatory activity? Yes or no? Just simply type yes or no. Very good, yes. Kasi iya mang gi-inhibit ang pinaka-top. Kung inhibited yung top, yung PLA2, wala nang arachidonic acid. 'Di ba? Di wala na pud. Asa naman wala may arachidonic acid, dili siya mo wala na pud ang pathway nga COX and LOX. So meron siyang somehow anti-inflam and anti-asthma activity yung steroids. Okay? And all of these drugs that targets arachidonic acid pathway as a whole, arachidonic acid pathway na ni siya as a whole. Okay? Mga functional modifier din. Di ba? Okay, these are all cells. Mga enzymes are cells. Okay? Yung normal activity ng enzymes na to, gi-inhibit, gi-alter, gi-modify. Okay? So, functional modifier sila. Okay? So, that's all for the functional modifiers. Again, functional modifiers, they modify, they alter the biochemical activities of cells in the body. Okay? Ayan. And there are also other drugs that could alter biochemical activities ng cell in the body, and most of the drug classes nga ato ang ma-discuss later on sa preceding modules are also considered functional modifiers. So utang ko muna yung ibang mga drugs kaya ato man gihapon na silang mga tackle. Basta you know the concept nga basta functional modifier, they can modify, they can alter the biochemical activities ng cell. Okay? So, let us now proceed to the second class. Okay, another class of drugs, classification of drugs. We have replenisher. So, madali na yung tatlo. Replenisher. Kasi, konti lang yung mga drugs na replenisher. Ano yung next? Diagnostic agents, saka yung chemotherapeutic agents. So, replenishers, from the term itself, replenish. Diba? Kung mayroon kag-replenish, when you define the root word, replenish, ibig sabihin to supply. To supply, bakit ka magsusupply? Kasi merong lacking. Okay? Merong lacking, may insufficient amount of a particular substance. And those are endogenous substances. Kasi pag sinabing endogenous, endo, inside. So, naturally produced inside the body. Okay, mo na inyong dumduman basta endogenous, natural substance. Okay, naturally produced inside the body. That is why, kung replenisher, ga-supply man ka, o lacking endogenous substances, they are also considered as supplements. Okay, supplements, nagsusupply. Okay. Say for example, kapag, di ba may mga pasyente na mababa yung potassium level sa blood, so may hypokalemia, mababa ang sodium sa blood, hyponatremia, so ganun. Pag mababa ang potassium, mababa ang sodium, okay, or mababa ang any ions important sa body or sa blood, okay, meron tayong electrolytes, di ba? Tinatawag na electrolytes. Example ng mga electrolytes. Example, mababa yung potassium. We have potassium chloride. okay, that could replenish the lacking potassium ion in the blood. We have sodium chloride, we have calcium chloride, etc. So yan yung concept about replenishers. So example, electrolytes, vitamins. Okay ba? Vitamins are known as minerals and they are required for the body to work properly. For example, mahina yung immune system mo. Okay, so to boost the immune system, you can have vitamin C. Pwedeng vitamin C with zinc. Okay, so those are replenishers. For the eyes, you can have vitamin A. For the bones, para ma-enhance yung absorption ng calcium in the bones, you need vitamin. Sa may kinahanglan gani, para mas mo-absorb lalo yung calcium sa bones. What do you think? Ang importante sa, very good, vitamin D. Okay, basta bones, vitamin D. Okay, so yan. Okay, another is insulin. So insulin, this is a protein, but mostly consider siya as hormone. Okay? Okay. This is considered as protein. Protein siya, pero mas describe siya as a hormone. Hormone being secreted. This is being secreted by the of beta cells of the pancreas or the pancreatic gland. Okay, yan yung insulin. And I bet you're all familiar with insulin. Para saan ba yung insulin, di ba? This is very important for the regulation of blood sugar level. Pag sinabing regulation, very important siya to lower, regulate, modulate, di ba? I-lower, kaya niyang arrow down is lower na. So, dili na nako butang og lower nga word. Okay? Ayan. So, it can lower the blood sugar level. Okay, very important siya for the regulation of blood sugar level. Yan yung insulin. That is why kapag mababa ang insulin, kapag lacking, insufficient yung insulin in the body, ano yung mangyayari sa blood sugar level? Kapag mababa yung insulin sa blood, okay, systematically, what do you think? Taas or baba? Very good. Tataas, increase yung sugar level. Kasi nga, walang available insulin. Again, insulin is very important to lower, okay, to lower blood sugar level. Kung bababa ang available insulin sa blood, okay, hindi bababa yung walang magre-regulate, walang magmo-modulate ng blood sugar, talagang tataas yung blood sugar. Ano yung disease na yun or condition kapag may hyperglycemia, mataas yung blood sugar? Very good. Diabetes or the diabetes mellitus. Okay? So, a rising problem kapag mababa. Okay? One of the reason bakit ang pasyente one of the reason lang bakit merong diabetes mellitus is mababa yung insulin or talagang zero, as in absolute zero, walang insulin na nare-release yung beta cells ng pancreas niya kasi na-destruct yung beta cells. There are types kasi, particularly type 1. Yung type 1 nga diabetes mellitus, ang reason bakit zero talaga, walang insulin na nasisekret yung beta cells ng pancreas kasi there is destruction of beta cells. And it is the beta cells that secretes the insulin. So kapag walang insulin, talagang zero. Kung walang beta cells, destructed yung beta cells, talagang zero, absolute zero, walang secretion of insulin. Okay, talagang hyperglycemia ang result, type 1 diabetes. Okay, so para ma-manage yun, si insulin will be used as replenisher. Kasi mababa, walang insulin, lacking, insufficient insulin, then prescribe insulin therapy to type 1 diabetic patients. Okay? Kasi yung type 2, yes, rarely lang sa type 2 diabetes mellitus kasi. Sige, hatagan lang tamog idea. Sa type 2 diabetes mellitus, ang nangyayari, normal nga merong insulin. Okay, normal good. Hindi lacking, normal level ang insulin. Ang kakahitabo lang sa type 2 diabetes mellitus is nagiging insensitive ang receptor. Naanagani si insulin, wala siya reaction nga miski ni bind na si insulin sa iyaha, I mean, naa ang insulin receptor miski ni bind na si insulin, wala effect. Dili ga lower ang blood sugar. So nagiging insensitive due to insensitivity of the receptors ng insulin. Okay? So kaya hindi usually binibigay yung insulin sa type 2 diabetes kasi normal man ang insulin level. Yung usual na binibigay is talagang hypoglycemic agents. Okay? So later on, ato nang sa pharmacology 2 na siya, madiscuss ang diabetes mellitus na disease. Okay? So yun lang, sa type 1 diabetes mellitus, since lacking, insufficient, zero yung insulin, sa insulin therapy binibigay to replenish, okay? To supply the lacking insulin in the body. Okay? So yan. So we're done with replenishers. Okay? So let's have the diagnostic agents. Okay? So from the term itself again, diagnostic. Diagnostic. So these are used for diagnosis. Okay? For diagnosis. Ibig sabihin, kani nga mga agents, these substances, they are used to examine the body in order to detect problems, abnormalities, or impairment sa body's normal function. Okay? So kani nga mga agents ginagamit para ma-evaluate nga o meron siyang abnormality dito. Okay? Ma-diagnose siya with this kind of disease. Okay? Kumbaga kaya niyang i-detect yung malfunctioning, okay, sa cell ng body. Okay? So example, si tensilon. Si tensilon, i-ano lang ninyo ang mga sakit ha para dili lang yun nato siya i-focus. Basta alam niyo lang nga these are example of diagnostic agents. Okay? Si tensilon, it helps the doctors nga ma-diagnose nga ang pasyente merong myasthenia gravis. Okay? Myasthenia gravis. This is actually an autoimmune disease. Okay? Again, ang tensilon, it helps the doctor diagnose myasthenia gravis. This is isang autoimmune disease kung saan nagkakaroon ng weakness sa muscles. Okay? Yung technetium 99M, yan ay isang radioactive agent. Ang dinedetect naman niya na problem is problem resulting to coronary artery disease. Okay? Kaya niyang mag-detect. It could detect coronary artery disease existing. Okay? Ang thallium, this is also radioactive. Okay? Radioactive agents, technetium, yung thallium, radioactive agent. This is usually used naman to examine heart. So, ano lang, to examine the heart para ma-obtain yung information about blood supply. Okay, particularly blood supply ng heart to the not really blood supply ng heart, pero kung bitaw, para iyang ma-detect to see how much blood is reaching to the different parts of the heart. Okay? Yan. Yan yung ginagawa ng thallium. Isang radioactive agent na ginagamit to detect, to see how much blood ang na-reach, okay, sa different parts of the heart. So, blood supply. Okay? Ng person of heart. Oops. Oops. Okay. Nabasa ninyo. Ako to best friend. Uy, ako kayo sa pag-chat. Best friend. Okay. So, ayan. Namigilibak manggod. Kanang pala utang ba, my friend? Sige, anyways. Sige. So, we have disopyramide and dobutamine. Okay, yung dobutamine, this is very important to help the doctor determine if ang heart is functioning well via inducing stress sa heart. Okay, yung dobutamine. Okay? Ginagamit siya sa stress test. Yan yung term, stress test. Bali, ga-induce og stress sa heart para ma-determine kung unsa ka kakaya sa imong heart. Unsa ang functioning bitaw sa imong heart. Gano kakaya sa imong heart. Unsa nga level nga stress, ana bitaw? Unsa ka level nga stress ang kaya sa imong heart. Heart's function or heart's structures. Okay? So more on heart related yung tatlo, 'di ba? Yung CAD, coronary artery disease, blood supply, lobutamine. Okay, so that is diagnostic agents. Basta, ang inyo halang concept is, these are group of agents, classification of agent nga kayang mag-determine, mag-examine ng body to detect abnormalities, to detect impairment, problems sa normal body's functioning. Alright? So, that's it for diagnostic agents. Okay. And lastly, we have chemotherapeutic agents. So, ang chemotherapeutic agents naman, simply lang, it inhibits growth or it kills cells. Take note, it inhibits growth or kills cells nga foreign in the body. Pag sinabing foreign, gikan siya sa outside source. Okay, dili gid siya natural sa atuang body. Example na ay microorganisms, parasites sa body, may cancer cells. Diba? Those are foreign. Okay, foreign cells in the body. So the example, so we have anti-infectives. Diba? Anti-infectives, it inhibits the growth of microorganisms, certain microorganisms. Okay, anti-neoplastics or anti-cancers. Okay, muna siya, anti-cancer or anti-neoplastics, it's the same. They counteract cancer cells. Okay? So I hope inyohang ma-determine na ang differences ng four classifications of drugs. We have functional modifiers. Ang functional modifiers can alter, modify biochemical activities ng cell in the body. We have replenisher, nagre-replenish siya ng lacking endogenous substance in the body. Kapag diagnostic agents for diagnosis purposes to detect, evaluate impairment, problems, or mga abnormalities sa body's normal functioning. And chemotherapeutic agents, yung mga foreign cells naman, yung tina-target nila. Okay? Or gina-inhibit yung growth ng mga foreign cells. Okay? So, that's all for lesson 1 under module 1. So, to end our lesson 1, let me remind you about this basic statement. Okay? For every pill, tandaan nyo to, for every pill, there is an ill. Okay? So kung gamot, okay, per gamot, meron yang potential harmful effect talaga per gamot. Okay, that is why we have that so-called side effects. We have so-called adverse effects at higher concentration of that particular pill or drug. There is always consequences nga harmful to the body. Not the other way around. Okay, dili nimo pwede balihon nga for every ill, okay, for every ill, there is a pill. Okay, wrong statement na siya. Kay hindi po lahat ng sakit, hindi lahat ng ill merong gamot. 'Di ba? Okay? Pero ito, for every pill there is an ill, that is somehow a correct theory or correct statement. Okay? Kasi lahat ng drugs, medications are potentially harmful because again, those drugs, exogenous na mga drugs, agents, chemical substances, they are not essential to the body's normal metabolic needs, di ba? Dili man ta gagamit og drugs para lang char-char. Okay? Na ay reason. Okay? Dili na siya part yun sa itong normal metabolic needs pero kinakailangan natin kasi merong kailangan i-alter, okay? Merong kailangan i-replenish, merong kailangan i-detect na problem or whatsoever. Okay? Na nangyayari sa body. Okay? So, any question under Lesson 1, Module 1. Okay,
Excuse me, ma'am.
oh yes.
Ay, ma'am, unsa gani name atong pathway ganina, ma'am? Cox pathway to siya.
Yes, Cox pathway lang ang akong gi-focus, but at the end katong whole na gyud nga um dito pathway, it's either you can answer LOX and COX pathway combination or the metabolism of arachidonic acid pathway. Okay, you can have that.
Thank you, ma'am.
Mm, yeah, sure. Sige, any other questions sa lesson 1? So that we can proceed to lesson 2. Miss Ken, ato lang ma-introduce na ko ang lesson 2. None? Okay, none so far. The recording pa man siya. Okay. Sige, now let us proceed, excuse me, to lesson 2. Okay, ayan. So for lesson 2, uh, which is all about the principles of pharmacodynamics, yung outline of topics dine is divided into 4 parts. Okay, first, I will give an overview on the mechanism of action of drugs. Okay, and this will be followed by the concepts of receptors. Okay, ano ba yung receptor? And ano yung major families ng receptors? This is very important. Okay, yung families, yung types ng receptor. Okay, yung drug receptor interactions, and finally, yung dose relationship. Okay, dose response relationship. Okay, so this would be the outline under lesson 2. So let's start. Okay, let's start first with balikan muna natin yung concept ng pharmacodynamics. Okay, bago yung mechanism of drug action. Okay, pharmacodynamics principle man na siya. So recall natin again, what is pharmacodynamics? Ano ulit sabi natin about dynamics? Pakitype ang sagot. Is it drug to body or body to drug? It is D to B or B to D. Very good. Drug to body. Okay, that's nice. Very good. So again very good. Again, sa pharmacodynamics, ay kalimti, dynamics, so maguna sa drugs. Drugs to body. Okay, so it has that question, what the drug does to the body. Diba? What the drug does to the body. Okay? And recall ulit, drugs targets the body, the drug targets the body. Bakit siya nagta-target ng body? In order to produce an effect. Okay? In order to produce an effect. However, we must also realize that it is not only it is not only the drug that interacts with the body, okay, to produce an effect. Okay? Because we have that so-called, sulat ko na lang we have that so-called endogenous compounds. Okay? Di ba na-mention ko kanina, mga endogenous compounds. Okay? Again, please realize nga hindi lang drug ang nag-i-interact sa body to produce an effect. Okay? Meron ding mga endogenous compound. Ang drug kasi exogenous. Okay, wala man tay drug nga sariling sikap ni produce ang drug sa atuang kuan, di ba, sa body. Exo man gyud na siya, exogenous source man gyud ang drug. Okay? But we have natural compounds, we have endogenous compounds that interact to the body to produce an effect. Basically, these endogenous compounds, i-define natin, these are body's own natural compounds. Again, body's own natural chemicals or compounds. Okay? Now, kapag sinabing natural natural ulit, ginagawa ng ating katawan. Okay? Natural, ginagawa ng ating katawan. So, natural compounds that also interact to the target proteins, to the target nucleic acid in the body to produce an effect. So example, sorry, example ana ma'am. Example mga neurotransmitters. Kamu na lang mag-spell out ha. Neurotransmitters. Another example, hormones. Okay? Another example, otacoids. Okay? Otacoids. Okay? Ayan. Again, examples of endogenous compounds that are naturally produced in the body that interacts also sa body, sa cells ng body to produce an effect are neurotransmitters, hormones, otacoids. Neurotransmitters and otacoids, this will be discussed sa PICOL 1. Ang neurotransmitters, most specifically, maato ni siyang matakol under ANS and CNS drugs, under autonomic nervous system drugs, central nervous system drugs. Otacoids, siya ang module 2. Okay, under niya sa atong module 2 after ANS drugs. Ang hormones, pharmacology 2 na nato ma-discuss ang different hormones sa body. Okay? Again, these are all endogenous compounds, okay, that interacts with molecular targets. Now, in designing drugs by medicinal chemists, they usually synthesize drugs that would at least resemble, okay, that would at least resemble the structures of endogenous compounds. Okay? So, kanang model, ang ginamodel gyud sa pag-synthesize, sa pagbuo ng mga synthetic drugs, okay? Or sa pag-research sa advances ng mga medicines, ang ilang ginamodel gyud ana is yung structure ng endogenous compounds. Okay? So, we have this exogenous compounds. These are foreign naman. Okay? Foreign substances. Okay, an example nga doon is or are drugs. 'Di ba? Example are drugs. Okay? Now take note ang technical term for foreign substances or drugs kapag na-administer na yan sila sa katawan or nakapasok na sa katawan yung foreign substances, ang term ana nila, okay, are cynobiotics. Familiar mo ana? Cynobiotics. That is the technical term to describe a foreign substance kapag nakapasok na sa katawan, kapag na-administer na siya inside the body. Okay, so those are cynobiotics, mga foreign substances. Okay, so that is the difference between endo and exogenous compounds. So madali lang yung hint. Endo, inside, so naturally produced. Exo, outside, so mga foreign substances. But ano yung similarities nila? Both of this can interact in the body. Okay, they can interact with the target, okay, in the body, target protein or nucleic acid. Okay, producing an effect. Okay? So 5 minutes na lang, sige. Ako lang gihapon kuha na to ng 5 minutes, 11:30 matatama. Now, in studying pharmacodynamics of drugs, it is very important to understand dapat ato i-understand their specific way to interact in the body producing ang effect. Dapat each drug has its mechanism of action man to produce an effect, to produce a response to the body. Kasi ito yung all about pharmacodynamics. It is about interacting ng drug to the body to produce an effect. Now, paano ba nag-i-interact yung isang drug? Siyempre, meron silang specific mechanism. Meron silang specific ways to interact with the body, producing an effect. Okay? And ano ba yung mga general ways? Ano yung mga general mechanisms ng drugs to produce an effect or to produce a response. We have two major responses. Okay, ayan. Dalawa yung major response, not responses, major mechanism of drugs action. Again, correction, there are two major mechanisms of drugs action. Okay, kung paano sila nag-i-interact sa target site, okay, in the body. So we have in general target protein mediated. Meron din tayong non-target protein mediated. Now, pag sinabing target protein mediated, uh, by the term itself, yung way of the drug to produce its effect is via binding to the active site of protein. Kasi nga, target protein, meaning na-mediate yung effect if that drug is a protein targeting drug. Alright? Again, target protein mediated, ito yung way of drug to produce its effect. Yung way of drug niya to produce an effect is via binding to the active site of protein. So, target protein mediated. Meron ding mga drugs na hindi na kailangan mag-target ng protein. Iba yung mechanism of action nila. Okay, so pag non-target protein mediated, ibig sabihin, they produce their effects. Okay, the drug produces its effect without binding to the active site of protein. Okay, so 2 minutes na lang. So, ayan. Okay, so pag sinabing target protein mediated, again ha, protein targeting siya. Therefore, we have set of example ng proteins, types of proteins, kung saan nagta-target yung drugs. So we have under target protein mediated, we have structural proteins ang gina-target ng drug, napuntay drug na regulatory proteins yung tina-target nila. Okay? Say for example, under structural protein, meron ba akong na-mention na gamot that could target structural protein? Ano yon? A drug, example of a drug that targets a structural protein. Ano yung example ng structural protein? Very good.
Colchicine.
Yes, very good. Yes, very good. Colchicine. Colchicine, di ba, naalala, yung MOA niya, yung mechanism of action, yung MOA niya is kaya niyang i-depolymerize yung tubulin. And tubulin is a structural protein. Tama? Ano ba yung structural proteins? In general, these are very important for cell framework, for cell skeleton. So, example doon si tubulin, si microtubules as well. Okay? So, dili na nato tagsa-tagsaon. Maghatag lang ko example para masabtan ninyo nga naaday lahi-lahi mechanism of action ang drugs. Pwedeng target protein mediated, pwedeng non-target protein mediated. Yun lang yung purpose sa slide na to. Okay? Then example lang dayon para ma-appreciate ninyo siya. And so, 11:30 na. So, I will continue the discussion next meeting.